Knowing how to take vital signs is a very critical skill that I think everybody should learn. Not only for those who are wanting to go into the medical field, but also for those who may be placed in an emergency situation where taking vitals may be needed. Learning to take vital signs can be very beneficial in your future if you are ever placed into a situation like this. Ever since I was little, I've always been super interested in medicine. With my dad being a medical professional, I was exposed to medicine at a very young age. As soon as I got into high school, I began taking as many health science courses, anatomy and physiology courses as I could to be even more exposed to medicine. Last year, I was able to obtain the title of a CNA. Hopefully next semester I will get my CMA as well. The first vital sign I'm going to show you today is how to take pulse. Most of us already know that pulse can be taken in many places, whether it's your femoral, your carotid, your brachial. Most of us know the radial pulse, which is found on your wrist. When you take pulse, you want to be on the left side of the patient's wrist, because this way you can find a stronger and better pulse, not the right, because this is a weaker pulse and can lead to an inaccurate reading. So once you find the pulse, you begin counting how many beats there are. Pulse can be taken for a minute, it can be taken for 30 seconds or 15 seconds, depending upon how much time you have given whatever your circumstance is. When taking pulse for 30 seconds, you want to multiply it by 2, getting the whole 30 seconds for that reading, or if you take it for 15, you want to multiply it by 4 to equal that 60 seconds. One thing you want to remember when taking pulse is you want the patient to be very relaxed, very calm, breathing steadily so that it's not inaccurate and can lead to a better pulse reading. An average pulse should be around 60 to 100 beats per minute. Moving on, and the next vital sign I'm going to show you today is blood pressure. This can be one of the trickiest to learn just because it's hard to learn and it can be very inaccurate sometimes. Today I have an electric blood pressure cuff with me, but I will show you and tell you how to use a manual cuff while I'm showing you how to do this. So, the first thing you want to do when taking blood pressure is you want to, use your arm, I'm going to roll up your sleeve.
Bring out the gun show.
You want to wrap the cuff around the patient's bicep muscle as tight as it can go. Sorry. Tight enough? Mm-hmm. Okay. And as I press start on here, I'm going to tell you how to take it with a manual cuff. So, on a manual cuff, you want to inflate the cuff to 180 millimeters of mercury. Once you have obtained 180 millimeters of mercury, you want to slowly deflate the cuff at a rate of 3 millimeters of mercury. Once you start deflating the cuff, you are wanting to hear for the first beat. This is known as the systolic pressure. As you keep deflating the cuff, you want to now listen for the second beat, which is known as the diastolic pressure. Once you have completely deflated the cuff, this is your full blood pressure reading. A normal blood pressure should be around 120/80. This is normal because this is allowing your heart to not pump as much blood through your body. It's not working as hard to pump blood through your body, which is very good. Most athletes have a lower blood pressure just because they're more in shape. But yeah, as her blood pressure is 117/74, very normal, which is good. Good job. And the last vital sign I'm going to tell you about today is respirations. This is the easiest vital sign to take just because most of your focus needs to be on the patient's chest. So, when counting respirations, you want to count how many times the chest rises and falls, meaning that is one respiration. Respirations should be taken for 1 whole minute, and this can't be skipped just because it's different than pulse or blood pressure or anything like that. An average respiration should be between 12 to 20 breaths per minute, which is normal. So, in conclusion, the 3 main vital signs I have shown you today are pulse, blood pressure, and respirations. If you take the time to learn these and be confident in them, these can be very useful in any medical situation or emergency that you might be in where anybody might need skills like this. And I hope that you take this information and use it for yours and others' aid. Thank you.